Today, we are going to learn about the self-breast examination. First, let us look at what self-breast examination is. Self-breast exam is a step-by-step procedure to check your breast for tumors that could be cancerous. What is the purpose of doing the self-breast examination? The regular self-breast examination helps you become familiar with the usual feel of your breast. The purpose of breast self-examination is not to identify breast cancer, but to determine whether what you feel or see is normal or abnormal. There are some steps to follow while doing the self-breast examination. They are inspection before mirror, palpation in lying position, palpation in sitting or standing position. Why should self-breast examination be done? It is important to do because you will detect any lumps in the breast at an early stage of their development. Although only 1 in 10 breast lumps is cancer, 1 out of every 15 women will develop breast cancer at some time. Most breast cancers are found by the women, not by the doctor. Early detection of a lump gives a better chance of a cure, even if it is breast cancer. When to do it? Breast examination should be done once a month, a few days after the end of your period. There are some specific instructions given for breast self-examination so that it will be done effectively. For vertical strips, examine up and down the breast in vertical strips, beginning from the outer border. At the end of each strip, move the fingers about 2 cm towards the breastbone and examine another vertical strip. Flat of your fingers. Use the flat part of your fingers, including the fingertip pads, to feel the breast. Move your hand in slow circular movements. Light and firm pressure. At each spot, feel first with light pressure to detect any lump just below the surface. Then, with a firm pressure to detect any deeper lumps near the ribs. When finished, reverse the position to examine the other breast. Here are the steps given for breast self-examination. Do it for yourself every month and teach others as well. Step 1. Lie down with your back and keep your left arm under your head. Use your right hand's 3 middle fingers as a pad to examine your left breast. Move gently and make a small circular motions over the breast. Check for any lumps or thickening by using a different levels of pressure as light, medium and firm. Check for the whole breast from the collarbone above and down to the breast below. Now do the same for your other breast as well. Step 2. Stand in front of the mirror. Keep your hands on the hips both sides. Look for any abnormal shape, size, swelling and dimpling of the skin. Step 3. Raise your arm and check under for any lumps. Repeat the same for the other arm as well. Step 4. Check your nipples for any fluid or discharge by squeezing them gently between your fingers. What should you do if you find a lump or thickening? If you find a lump, dimpling of the skin or a discharge, make sure you see your doctor as soon as possible. Please do not be afraid or put it off, because most changes are not cancer. Thank you.